The Ministry of Health has developed a digital platform where all health-related data to COVID is captured and stored. And the government has gone ahead to provide a link where the public can be able to use to access the platform, to be able to register, to log in, and to update their own details in as far as they understand and know, so that we minimize on errors to do with identification, names, and anything that relates to the individual. So that is the platform that the government has put in place. It will be used specifically to provide services to those who will be accessing the vaccines in their facilities, and also used for planning. So the health facility will use this knowledge to be able to plan for the services, to know how many people are coming each day, who are they, and the government will use the service statistics to be able to plan for provision of services across the country. Once an individual has been able to visit the platform, registered and logged in, and they have their details uploaded, they'll be able to also pick the facility where they want to be vaccinated, and where possible, including the dates when they want to be vaccinated. That way, the facility will be prepared to know that a certain number of people are going to visit this facility for vaccination on this particular day, and therefore be ready with the required materials and staff to provide the services, and by extension reduce the queues that previously we've been seeing in the health facilities, because one of the things we want to do is to reduce crowding. So through this platform, the crowds will now be a thing of the past, because individuals will be going at their choice of time and their choice of facility to be able to access the particular care that they need. The portal is a self-interactive portal where an individual just logs into the system. You go into the internet, you type the URL link. Once you type the link, and it is https://portal.health.go.ke. Then once you access the link and you go to the portal, the first thing you do is you register yourself, you register your details the way you understand them best. Once you register the details, the platform will pick your details and store them. And when you log in, you can be able to pull your details. And one of the things that you'll be able to do with the system is that you'll be able to plan for when you are going for your next visit. You can be able to see when you are supposed to visit the facility for your next vaccination. You'll also be able to see the way that your names look like, your ID, your date of birth, and all your demographics, whether they are correct. You'll also be able to interact with the system to pull down your certificate of vaccination, so that you can be able to interact with it anytime in the world. And this certificate that is embedded within the system has security features through the QR code. Those security features are specific to you, and it also shows that you have been vaccinated through the database that the country has developed. So when you travel anywhere in the world and you log into the system and you download your certificate, it has those security features. Those are specific, they are authentic, and they cannot be copied. There are attempts by people to try to copy this, but when you read using a reader, then you'll be able to know who the person is, and if it is corrupted or somebody is trying to replicate, it will be showing that that name does not exist in the system. Therefore, making the system to be very secure by making sure that that certificate is personal and it is stored, your data is stored in a safe and secure environment that is provided by the Ministry of Health, by the Government of Kenya. The Government of Kenya is cognizant to the existing laws that have been passed by Parliament. The first law that the government has passed is the Health Act 2017, which makes it mandatory for all health facilities to make sure that they report their data. The Data Protection Act 2019 is also very specific as to the terms about which data should be stored in which way. And the government is very committed to making sure that the data that is collected which is classified as sensitive data because it captures the individual personal details. This data is stored in a safe and secure environment that the government has provided, that nobody can be able to access or break through, because the government has put in place measures to ensure that that data is not only safe, but it is collected and transmitted in a safe and secure environment, and that it is only used for the intended purpose and no other purpose. And the purpose is to serve the public and also to provide the planners with the right fodder for them to use to plan for provision of extra services in Kenya. For you to be able to access this platform, there are several ways in which you can be able to interact with the system. The first one is, if you are lucky to have a smartphone, you can use the smartphone and to be able to provide all your details in the stepwise manner that are provided. The other way is that if you have Wi-Fi and you have a laptop or a computer, you can also be able to do the same. If you don't have this, you can also visit a cyber cafe where the details can also be provided, and you can be able to link to the system and provide your details. You can also be able to visit a neighbor. For those who do not have smartphones or they don't have Wi-Fi, you can visit a neighbor who has a smartphone or has Wi-Fi to assist you to register. But if all this fails, you will still go to the health facility. And in the health facility, the same service will be provided to you, and you can still be able to log and upload your data as required. So there are several ways in which an individual can be able to access and to provide their details into the system. There is a big problem that is not only existing in Kenya but existing along the world, and this is the disease called Covid-19. And for us to be able to effectively manage this disease and to eradicate it, we must be able to vaccinate people, to create the right pool of what is sometimes called the herd immunity in the community, so that we cut off on the transmission. The only way we can do that at the moment is to follow the protocols that the government has put in place. But in addition to keeping your safe distance, constantly washing your hands and sanitizing and wearing a mask, we also have to vaccinate the population, because that creates the body's resistance or immunity towards this disease. And for us to know that you have been vaccinated, you can only be entered into the system once you have been vaccinated. So once the system captures you as having been vaccinated, then that data is stored and used to know the proportion of the population that has been vaccinated, to understand the places where services are not available, to understand the behavior of people. For example, there are some parts of this country where maybe females are accessing the services more than the males. We need to address those type of challenges. We can only get to understand this if we collect the data as a ministry and as a government. So that data is stored in a particular place to be used for those type of services. In addition, once you have been vaccinated, either first vaccination or the second vaccination, you can be able to interact with the system and get your certificate. So this certificate is important to you in several ways. One, it shows that you have been vaccinated, and it shows when you are vaccinated, and it also tells you when you are due for the next vaccination. So you can be able to track and to know when you are expected to visit the facility for your second dose. And it doesn't have to be the same facility. You can go to any other facility, because the system is able to capture all Kenyans. In addition, if you are traveling, then this certificate becomes important, because at the port of exit and the port of entry, you may be required to produce a certificate to demonstrate that you have been vaccinated against COVID-19. So the database that captures all your data has been created in such a manner that it is very, very secure, and it is very, very safe, and that nobody can be able to access. The certificate that you are getting is also authentic in as far as it is being produced by the system. Of course, there will be attempts by people who want to demonstrate that they can have the certificate outside the system. But because it has the features, the security features which are embedded within the QR code, then the QR code will be able to point at the database where the data is domiciled. And if the QR code in one way or another is not authentic, then it will not be able to point to that particular database. In addition, It will also lift the names of the individual. So you cannot change the name in the certificate and hope that the QR code will also change to conform to the new name that you are trying to corrupt. Because once you read the QR code using the scanners, then it will read the name of the original person. In other words, the name which has been corrupted will not be showing in the database, and therefore it will show that this is a fake certificate. So the certificate that is produced from the system is not only authentic, but it is secure and it can be used anywhere. You can also be able to verify by using a scanner to see that it is authentic. At the moment, the Chanjo KE system offers the services for vaccination against COVID. But in the near future, and this is because the disease came too fast that we had to do something very urgently to address the current situation. But as we look forward, this particular portal will be available to the public, and it will be expanded to provide additional services to the individual at the community and at the comfort of their homes or in their offices. And some of these services will include, for example, if you are a diabetic and you've taken your blood sugars that morning and you want to upload it into the system, you can use that portal to upload your blood sugars, your blood pressure. You can be able to track the trend of when of how your blood sugar is behaving or your blood pressure, so that at the comfort of the place where you are seated, you can be able to monitor your own individual health. This is where the ministry wants to push this portal to. In addition, the portal will be expanded such that you can be able to book appointments in the health facility, and you can know when you are expected to go to the health facility. You can be able to know which type of services are available in the nearest facility to you. So that if you are looking, for example, to a surgeon, you can just log into the system, say I'm looking for a surgeon, and the system will pull for you the surgeons who are near to you, and you can be able to book those particular services at the comfort of your seat, wherever you are. That is where the direction we want to take this system, so that public can be able to interact with the health facilities at their convenience and not the convenience of the health facility. Because the system that the government is developing is patient and client-centric. In other words, the interest of the patient, the interest of the client are what will supersede other interests. So you as a client, you interact with the system, you tell the system what you want, and when you go to the facility, everything has been prepared and it is ready for you. Moreover, it will be able to assist you also to move from one facility to the next. This system is so robust, such that there will be much more that will be provided, including other services to do with insurance, payments, and all this. And you can be able to see them at the comfort of your home. So the system that you are describing for traveling is called a Jitenge system. So this is one of the modules that also addresses COVID. The portal I'm describing is purely for COVID vaccination, but it will be integrated with this other system so that we can be able to track movements of people. The system that you are describing is a system that is used when you are traveling across from one point to another. And this is specifically because in a plane, for example, we need to know you are seated where in that plane. Who was your neighbor? In the unlikely event that one of the persons in that plane turns out to be positive. Because if one person turns out to be positive for COVID, we need to know their contacts. And that system is able to track these contacts. So when you log in using that system, it's called Jitenge system, it's actually for you to be mapped where you are, your details, who was your neighbor, and in the event somebody turns out to be positive, then you can be tracked and to be asked to go for services, maybe to be tested. So that's a slightly different system, but it also fits into the same, and they are now being integrated so that even if you are at the community and you are being followed for COVID, in the event that you turn out positive, we also want to know, were you vaccinated or not? This is where now the systems start to interoperate and exchange information about you as an individual in a safe and secure environment, so that we build a database about you as an individual. On this day you traveled, you are in contact with so and so who was positive. Were you vaccinated? Did you turn out to be positive? Those are the details that the system wants to bring as a benefit to the individual. That's why I said the system is patient and client centric and not service centric. This system has done marvelous things for this country because for once we are able to get details about people who have been vaccinated. Who are they? Where are they? Are there places where services are not being offered? Are there people who are not accessing services? And the government is now planning, including the knowledge that some people may need to be visited at their homes, the outreaches that are now being planned. It's based on the knowledge that is being generated by this system. And moreover, this system was locally developed in a record time of 3 weeks. Local development. So we have purely 100% knowledge here that was used to develop this system, and this system is now being recognized not just in Kenya but globally. Other countries are coming to Kenya to say, hey, how did you manage to do this and how can we work together? Because diseases do not know boundaries. So at some stage, somebody who is in Kenya may cross to Uganda or Tanzania, and they also need a system where they can be able to check where is this person coming from. If you go to Chanjo KE system, you're also able to tell if you are registering as an alien, or you're using your passport, or you are a foreigner, because diseases do not know boundaries. And this platform will now be able to exchange ideas with other platforms in other countries so that we can build a robust system that serves humanity. So in brief, this system to me has scored full A, 100%, and it continues growing.